Good evening and welcome to our special report, HIV/AIDS, A Global Perspective. I'm Monica Teves, and tonight we'll explore the past, present, and future of one of the most significant global health challenges of our time. We'll uncover the history, examine current stats, and discuss prevention, treatment, and hope for the future. HIV, or human immunodeficiency virus, is a virus that targets the immune system, specifically CD4 cells, weakening the body's ability to fight infections. If untreated, it progresses to AIDS, acquired immunodeficiency syndrome, the most severe stage of the infection. Thankfully, with modern treatments, many people with HIV live long, healthy lives. While there's no cure, early diagnosis and access to care make a world of a difference. The history of HIV/AIDS is a testament to the resilience of science and humanity. In 1981, the first cases were reported in the US, sparking alarm about a mysterious illness. By 1983, scientists identified HIV as the cause of AIDS, marking a major milestone. In 1996, antiretroviral therapy, or ART, became widely available, transforming HIV from a death sentence to a manageable chronic condition. Today, global efforts continue to save lives and bring us closer to a cure. Let's look at the numbers. Globally, 39 million people are living with HIV today. While annual AIDS-related deaths have decreased to 630,000, certain regions face unique challenges. Sub-Saharan Africa accounts for 67% of all cases, highlighting the urgent need for resources and education. Meanwhile, Eastern Europe and Central Asia are seeing rising infections, underscoring the need for targeted interventions. HIV is transmitted through several key routes. First, through unprotected sexual contact. Second, by sharing needles or syringes. Third, from mother to child during pregnancy, childbirth, or breastfeeding. And finally, through unscreened blood transfusions in some regions. These routes of transmission emphasize the importance of prevention strategies like safe practices, routine testing, and access to sterile medical equipment. Now, let's turn to the progress in treatment. Antiretroviral therapy, or ART, reduces the amount of virus in the body to undetectable levels. This not only helps patients live healthy lives, but also prevents transmission. Another breakthrough is PrEP, a preventative medication that reduces the risk of infection by over 99%. Long-lasting injectables are also becoming available, making adherence easier for patients. Prevention remains a cornerstone in the fight against HIV. Condoms and safer sex practices significantly reduce transmission risks. PrEP and PEP are game changers for high-risk individuals. Needle exchange programs help prevent infections among people who inject drugs, and routine testing ensures early diagnosis. Prevention requires education, access, and commitment. While medical advances are remarkable, stigma remains a major obstacle. Fear and discrimination prevent many from seeking testing or treatment. In some regions, Cultural and legal barriers hinder progress. Marginalized groups, including LGBTQ+ individuals and sex workers, often face the highest risks yet the least support. Addressing inequality is essential to ending this epidemic. Despite challenges, there are countless success stories. Mother-to-child transmission has been nearly eliminated in many countries through treatment. Global programs like PEPFAR have saved millions of lives by providing art to those in need. The U=U campaign reminds us that undetectable equals untransmittable, breaking barriers and changing lives. The future holds great promise. Vaccine research is advancing, and scientists are optimistic about breakthroughs. The UNAIDS goal of ending the HIV/AIDS epidemic by 2030 is ambitious but achievable with global cooperation, funding, and commitment with equitable healthcare access. So, what can you do? First, get tested. Knowing your status is the first step. Second, educate yourself and those around you to fight stigma and misinformation. And finally, support organizations and initiatives that expand healthcare access and awareness. Together, we can make a difference. Thank you for joining us tonight for this special report on HIV/AIDS. Let's continue the conversation, spread awareness, and work toward a healthier future for all. Stay safe, stay informed, and good night.